We're learning more tonight about the unprecedented strain the pandemic is putting on our hospitals, with doctors and nurses working 12-hour shifts without a break. Medical professionals say they'll reach breaking point if the number of positive cases keeps rising.
Our hospitals may be ready.
They are well equipped, well resourced.
But our healthcare staff are exhausted and struggling.
Working these long shifts, covering sick colleagues, not being able to take breaks to have a drink because you're in PPE all day. We just can't keep that up indefinitely.
Dr Aaron Bloch works in one of Melbourne's major hospitals and sees firsthand the impact of COVID-19 on patients and colleagues.
There's an element of fear and anxiety amongst our workforce at the moment. No, we're not taking a backward step. We're going to come into work each day and we're going to do our best, but we're really struggling at the moment.
Morale's quite low at the moment. The job's not that fun, wearing all the gear and having to take all those precautions.
Today, 11 more healthcare workers have contracted coronavirus, taking the total to 405.
We're losing so many staff. You know, we're having to really do double the work with half as many doctors. I'm not sure if people have seen images early on of Chinese doctors collapsing, which all frightened us. And I think, you know, part of that was COVID, but part of it was pure exhaustion.
Their job will be far, far easier if we all do our bit.
Although our healthcare workers are under immense pressure, new data shows the state is equipped to care for our sickest patients. Victoria would need to record between 960 and 1,885 new infections every day for 10 days to fill the state's existing intensive care beds. The Grattan Institute also found for every 100 people infected, 2 will require intensive care. Extra testing facilities are being set up every day, including this one at Melbourne Airport. It's one of 160 currently operating across the state. New sites too in regional centres like Bendigo and Ballarat.
I'm encouraged to see that the Victorian Government has dispatched further testing facilities and contact tracing expertise into the rural areas. I think that's a very important component of this control.
If you care about your emergency workers, you care about your healthcare workers, you have to be disciplined. Otherwise you are putting those heroes at risk.
TEEGAN, 7 News.